DHI versus FUE. If you ever thought about having a hair transplant and you did your research, you must have come across these two methods. In this video, we'll explore the key differences of these hair transplant methods, and we'll tell you which method is the best for your operation. And we'll be debunking some common myths along the way, so make sure to watch until the end.
First of all, let's set the record straight. We cannot say FUE technique and DHI technique. In fact, DHI and the traditional FUE methods are both techniques within the FUE category, or follicle unit extraction. This method involves extracting individual hair follicles from the donor area, usually with the help of motorized punches tailored to the patient's graft's characteristics. What you might be wondering about is the difference between the DHI FUE and percutaneous FUE. With the percutaneous FUE technique, our approach is first opening all channels where the grafts will be placed. This helps in creating a very natural appearance resembling the original placement and direction of the hair in the scalp. As for DHI FUE, the implementation of harvested hair follicles is done directly into the recipient's area using a specialized tool called a Choi pen or implanter pen, and that is without the need to open channels first. This allows for precise control over the angle, depth, and direction of the hair follicle placements.
Okay, this all makes sense, but how can we choose which one is best for our case?
If you have intensive baldness without any original hair, percutaneous FUE might be the way to go. However, for cases where there is no need to shave the entire head and only the donor area requires shaving, DHI FUE is recommended.
But I heard I should always get the DHI FUE method because it offers better results or high density than other methods. Is that correct?
Well, that's not completely true. In reality, the outcome largely depends on the number of healthy grafts we extract. Both DHI and percutaneous FUE can deliver comparable results. Typically, DHI is suitable for transplanting a moderate number of grafts, say around 3,000 to 3,500 grafts. DHI tends to be more time-consuming. For example, the transplants about 2,500 to 3,000 grafts using DHI, we would need roughly 7 hours. While percutaneous FUE accomplishes the same number of grafts in 5 hours. If you are looking at larger numbers, like 4,500 or up to 5,500, DHI might not be the best choice. One genuine advantage of DHI over percutaneous FUE is FUE is the post-operative recovery time and appearance. The scalp often looks cleaner and is faster after DHI procedure. This doesn't mean that DHI yields better long-term results, but the immediate post-op appearance can be more appealing.
Great, so the best method depends on each individual case. Also, from what I understand, you don't always have to shave your entire head. So why do most hair transplant clinics almost always shave it?
Regardless of the method chosen, we generally advise patients to shave all of the hair for several reasons. Hygiene. A clean cut reduces infection risks. Safety. Existing hair can potentially damage newly transplanted grafts, especially during sleeping or washing. Easy post-op care. The shaved head makes it simpler to wash the scalp and remove scabs, especially crucial in the first 10 to 12 days post-operation. And lastly, visibility. With a shaved scalp, we can easily identify and fill gaps without harming the original hair.
There you have it. Hope you learned something new and useful from this video. Thanks for tuning in. Remember, always consult with a hair transplant specialist before making any decisions. And if you have any questions, please leave them down below and we'll try our best to answer them all.